A lot of people come into my office and they're interested in using weight loss medications of various kinds, including our GLP-1 medications. And they say, I think I'd like to try it for 6 months. And then we need to have a conversation about how medications used for the treatment of obesity is really a long-term issue. And so it gets into conversations about how our bodies are wired. Our bodies are wired to regain weight. When we have lost weight, our bodies respond by increasing our hunger levels and decreasing our metabolic rate. So we're hungrier and we need fewer calories to stay at the lower body weight. Otherwise, we will regain. It doesn't matter how we lose the weight. If we lose the weight doing a ketogenic diet, if we lose the weight using an Ozempic-like medication, if we lose the weight with bariatric surgery, whatever we do to lose the weight, we're going to need to keep doing long-term in order to sustain the weight loss. That's just the way our bodies are wired. It's not special to the GLP-1 medications like Ozempic. The example I like to give is that if you go and have bariatric surgery, if you have a vertical sleeve gastrectomy, if you have a Roux-en-Y gastric bypass, once you've lost the weight, we don't go back and open up your stomach. We don't go back and change those things. We need those changes long term to maintain the weight loss. The same is true when we use medications. So there are a number of people who still really hold tight to the idea of, I think I'll be fine once I've lost the weight. And that is where we see a lot of treatment failures. It's a very small number of people who have lost weight successfully using medications who are able to go off those medications. It's a conversation, and it's something that I don't tell people it's zero people who will have success, but I do lay out, what does it look like? What we don't know, and what will be really interesting to see over the next 5 to 10 years, is that if somebody loses weight with a GLP-1 medication, can they switch to something else? Can they switch to a lower cost oral regimen such as metformin and phentermine, which is a stimulant that reduces appetite? Maybe, but we don't have those studies, and we're not likely to get big trials that show us the effectiveness of that because it's not in the drug company's interest to do those trials. So a lot of that is going to be individual experience. We might be able to see that there are many case studies in the examples of people who've done that for a variety of reasons. But right now, it's unknown, it's unclear. And so having the mindset, if you start one of these medications, if it's working, if it's effective, if it is not causing any harm, that we keep going for the long term because of the way that our bodies are wired to regain weight when we stop.